Okay, so I would start my procedure by performing wipes. I would wash my hands, introduce myself to the patient. My name is Sharon. I'm a student nurse with HCC. I would provide privacy for the patient, either by shutting a curtain or the door to the patient's room. I would explain the procedure. I'm going to do a head-to-toe physical assessment on you today, and I would also ensure the patient's safety throughout the whole exam. So I'm just going to start by asking you what your full name is.
Shakira.
Do you know the date?
November 20th, 2012.
And do you know where you are?
Green Mass.
Okay. So her responses to those questions show that her cognitive state, she's alert and oriented ×3. I noted while she walked in that her gait was steady. She was making smooth, coordinated movements. I also noted she appears to be clean and groomed. She's dressed appropriately. There's no odor coming from her. And those questions I asked her established that she seems to be communicating appropriately. Do you have any pain right now?
No.
Are you sleeping okay?
Yes.
Okay. So I'm going to start my assessment with the head. I'm going to palpate her scalp. I'm feeling for any sort of masses, lumps, any breaks in the skin. Skin looks intact. Everything looks good here. There's no alopecia. That's good. Next, I'm looking at her face, and I'm seeing that her ears and her eyes and her nose, everything is symmetrical. I'm looking at her skin. It looks good. The coloring's good. It's intact. There's no lesions, no masses, no edema, no moles, or any sort of other abnormalities to note. She opens her eyes spontaneously. I would ask her if she wears glasses.
No.
Did you have any kind of trouble seeing?
No.
Okay. How about hearing aids? Do you have trouble hearing?
No.
Do you wear hearing aids?
No.
Okay. Can you just lean forward a little bit? Can you hear this?
Yes.
Can you hear this?
Yes.
Okay. So her hearing seems to be good. I'm going to look into her ears with my light. Actually, I don't have my light. Hold on one second. Can you hit that button? So I'm going to use my light to look into her ears, and I don't see any sort of discharge or any bleeding, any redness, no drainage. Everything looks okay. Same on this side. I'm going to check her eyes. Just look straight ahead. Very good. Her pupils were equal in size, round, reacted to light, and accommodated to focus. I noted that her sclera was white and it wasn't discolored at all, so that's also good. I'm going to look in her nose, and there's no drainage, nothing there. That looks good. And next I'm going to put a glove on, and I'm going to check her oral mucosa. Can you open up nice and wide? So her oral mucosa is nice and moist and pink. There's no skin lesions, no abnormalities. Everything looks good inside her mouth. The next thing I'm going to do is, I did this already, I'm going to feel her neck, see if I note any swollen lymph nodes. Does this cause you any pain?
No.
I also can feel her thyroid, see if it's enlarged. And that's not, so that's good. And the last thing I'm going to do up here, I'm going to check her carotid pulses, one at a time. Pulse is nice and regular and strong. And this side, it's equal on this side too, so that's good. Alright, so I'll continue the assessment. I will do the chest area. I would be looking at her skin, noting any sort of abnormalities, making sure everything looks symmetrical, that there's no skin breaks, there's no lesions, no masses, no discoloration, no edema, moles, scars, anything like that. So I would be checking all of that. I'm also going to check her heart sounds. I'll go ahead and start with that. First I will listen for the aortic valve, and then the pulmonary valve, down a little further to Erb's point, and the tricuspid valve, and also the mitral valve, which is where I will listen for an apical pulse. So I'm going to just listen for a minute. Okay, so her apical pulse was 87. The normal range for an adult is 60 to 100 beats per minute, so that's good. I'm going to check her lung sounds as well with my stethoscope.
Let's go.
We go in kind of a Z pattern. It's more of a ladder, I think. Take a nice deep breath in and then exhale. Again. Another one. Blow it out. Nice deep breath in. Exhale. So her lung sounds are clear. The upper lobes of the lungs are best heard in the front. The right middle lobe is best heard on the right side. It's okay. And the lower lobes are best heard in the back. So I'm also going to have her lean forward so I can hear the side and the back. It's all right. Take another nice deep breath in. And exhale. Blow it out nice and strong. And in the back. Again. Exhale. Inhale. One more. Okay. Her lung sounds are clear. There's no wheezing or any kind of rhonchi or crackles, any or abnormalities. Everything sounds good. I'm going to check her pulse now. This is the radial pulse. I'll check that for a minute also. So I got 83 that way. And I would also check this side to make sure that the pulses are equal. Yes. We can also check her pulses up here. Her radial pulse is here, and this is the brachial pulse. One other thing I'm going to check is her capillary refill. I'll squeeze her finger and let it go and watch to see how fast the blanching goes away. And hers was nice and quick. Under 3 seconds is good. If it's more than 3 seconds, that's considered sluggish. And also the blood pressure, I will check that. This cuff is a little big for you. Oh, that's okay. You can just rest your arm. Checking for the pulse, and then I will do the blood pressure. Okay, the blood pressure was 108/60, and they consider normal for an adult 120/80 or less, so that's good. That's that. And also, when I was checking her lung sounds in the back, I was also looking at her back, assessing the skin, looking for any sort of lesions, masses, abnormalities, moles, making sure everything looked symmetrical and everything looked normal, like it should, and everything looked good there. So next I'm going to check the abdomen. So I'm going to lean you back here.
Ow.
Lean back. Is that as far as you go? There we go. Okay. So I'm going to look, that's fine, right there. So I'm just assessing the skin. I'm looking for any lesions, masses, discoloration, skin tears, moles, or any sort of abnormalities. Just lay nice and still. There's no visual abnormalities, so that looks good. Her abdomen doesn't appear to be distended, so that's also good. I'm going to use my stethoscope to listen to her bowel sounds. And after that, I will palpate. So first I will listen in the right upper quadrant. You want to make sure that you can hear bowel sounds. If you don't, you can listen for up to 5 minutes, but you have to make sure that you do hear them. If there is a lack of bowel sounds, that could be an indication of a problem. Her right lower quadrant. Left upper. And left lower. And I can hear bowel sounds in all 4 quadrants. That's a good sign. And now I'm just going to palpate. Her abdomen is soft. Does this cause you any pain? No. You can palpate for the bladder. You can feel if that was enlarged or if anything else was enlarged. Everything feels good. And at this point, we could also discuss elimination. So I might ask you how your bathroom habits are. If you're having any problems urinating or having bowel movements?
No.
Okay, so that all looks good. So backtracking just a bit, when I checked her radial pulse, counted for a minute, I checked both wrists. I also then checked her respiration rate for a minute. The normal adult is 12 to 20 per minute, and you want to make sure that it's unlabored and that looks good. So that was one thing I didn't mention. Now I'm checking her extremities. I'm going to look at the skin on her arms, and I'm going to note that there are no bruises, lesions, masses, edema, moles, skin tears, scars, tattoos, any abnormalities. I don't see any. I'm feeling her skin, and it's warm and dry, and it's intact. Everything looks good. Raise your arms over your head. Put them down. Okay, now put your hands out in front of you. Push down. Very nice. And push up. Her strength in both of her arms is equal bilaterally. That looks good. Do you have any pain when you move your arms?
No.
No. Okay.
A little bit, actually.
No. Okay, you're good. So then I'm going to check her legs as well. I'm going to look at the skin. I'm going to make sure there's no bruises, edema, lesions, moles, scars, tattoos, anything of that nature. There's no abnormal markings on her skin. The coloring's good. I'm noting that it is warm and dry and intact, so that's very good. Can you push up? Good. And down. And her legs also have equal strength bilaterally. I can check her pedal pulses down in her feet to make sure that those are equal. And that one's good. Nice, strong, regular pulse. Those are both good. That's all. Everything seems normal. And the last part of my assessment, I would talk to the patient. We could discuss things like nutrition and diet. I could ask how much fruits and vegetables she's eating, make sure she's drinking plenty of water, discuss the importance of those. Also physical activity, make sure she's getting exercise. That's very important for her health. And we could discuss any sort of swallowing problems that she might be having, or if she's having any nausea, vomiting, any other issues like that.